is the beginning of a new year after the end of a very long year. I am optimistic about what lies ahead for our city and our country, and I do believe there's hope on the horizon. That being said, we have really challenging days in front of us. Our daily average case rates of 237 cases per day remains alarming. And we've never had so many people in the hospital with COVID at one time. Right now, in this very precarious moment, we are seeing what the impacts of the holidays will be. Dr. Colfax will provide more insight into those numbers, but we won't know the full effect of the holidays for the next couple of weeks. At this point, San Francisco and the entire Bay Area are under the stay-at-home order for the near future. That means we currently have no control over lifting most restrictions, like those related to outdoor dining or personal services. What we do have control over is how we closely follow the health orders. We do have control over our individual actions that can lead us to improve our numbers so we can keep people healthy, save lives, and get out of these state restrictions. I know this continues to be so hard for everyone, especially our small businesses that remain closed or very limited in the services they can provide. We are doing everything we can to help. And today at the Board of Supervisors, they will vote on legislation I introduced to waive $5 million in city fees for small businesses impacted by closures. These are fees that had previously been deferred and are scheduled to come due in March. Frankly, deferring these fees is not enough. We need to eliminate them entirely. Our small businesses need any and all the help that they can get. While we have provided a lot of direct support for small businesses over the months, including over $24 million in grants and loans, we know we need to do more. That includes finding ways to provide more immediate relief, and we are working on that right now. We're also helping our small businesses apply for new rounds of PPP loans that are part of the new federal relief package. We know a lot of our small businesses have closed and are struggling to stay afloat, and we will keep working to find ways to support them in every way we can. We all have a long road ahead. December was a really hard month, and January is not going to be any easier. But like I said, there is hope. The rollout of the vaccine is something like we've never seen. Hundreds of millions of doses will be distributed around the country. This is going to take all of us working together. Today, we're joined by Dr. Josh Aldler, who is the Chief Clinical Officer at UCSF Health and Vice Dean of the Clinical Affairs at UCSF School of Medicine. Dr. Adler will speak a little bit about how UCSF is participating in the rollout of the vaccine. It's important for everyone to remember that the distribution of the vaccine is different from how testing was set up in this country. With testing, the federal government basically left it to the local and state governments to figure out on our own, which is why we created our own city-run testing system, City Test SF. And I'm really proud of City Test SF, which has put San Francisco at the forefront of providing testing in this country. But it is an expensive and complicated system that we built from scratch. With the vaccine, the federal government has purchased the vaccines and is distributing them through established networks of states and healthcare providers. So the vaccine rollout is a lot bigger than the city and the Department of Public Health, but we do have a role to play. And one of those roles is to distribute the vaccine to our city-run facilities. That includes Laguna Honda Hospital, where over 715 vulnerable residents currently live. The good news is that starting yesterday, working with Walgreens, we started vaccinating the residents of Laguna Honda. And by tomorrow, all residents who want the vaccine will receive it. This is in addition to the over 1,000 staff members at Laguna Honda who have already been vaccinated and more to come. Now, it's important for a moment to take a step back. Often these press conferences, we talk about numbers, we talk in data, we talk in concept, like infection rates and ICU capacity. We say things like we are taking certain actions to keep the virus out of Laguna Honda, but Laguna Honda is just a building. Viruses don't attack buildings, they attack the people in those buildings. They attack our seniors, people living with disabilities, our most vulnerable. Protecting the residents of Laguna Honda is very personal to me. My grandmother lived there for years at the end of her own life. So I know what those residents are feeling. I know what their families are feeling because they're not able to visit. Our fight to keep the virus out of Laguna Honda has been a fight to keep these people alive until we could do what we started doing yesterday, protecting them with the vaccine. And I want to show a few pictures from yesterday. This is a photo of Bernadette Yee. She isn't a statistic or some piece of data. She is someone who has been living for months and months in the type of facility that has seen outbreaks across this country. She, like so many others, have lived with the fear each and every day, and now she has the vaccine. Now she and other residents of Laguna Honda are waking up today with an end in sight. This next photo is Jasper Harris. While many of us had to sacrifice by staying home and limiting interactions, his sacrifice was to be in the facility where no one from the outside has been able to visit. He has had to deal with isolation and separation. Thanks to the hard work of the staff at Laguna Honda and all the policies our Department of Public Health has put in place, he is alive and well so that he can get the vaccine, so that he can keep on living his life. These are the lives we have been fighting for day after day to save. After months of uncertainty, they will now be protected. They are alive because of public health orders we put in place, because of the staff of the facilities who have done their very best to care for them, because of the Center of Disease Control who helped create a plan to protect this specific hospital, and because of everyone at Department of Public Health who has done the work day after day to keep our city safe. Like I said, this is a moment, but it's a real moment of hope for our city. And we should be so proud. I know it's hard right now, but remember that each one of these people in Laguna Honda being vaccinated is someone who will continue to have birthdays with families and visits with friends. They will have more time. They will have months and years ahead that so many across this country, sadly, have lost to this virus. I know it's hard to see, but there is hope. The people of this city have rallied together, even though these truly difficult recent months, and soon we will push this city forward. Look, I know the health orders can be hard to follow and confusing. I know people feel like the rules are shifting and changing and contradictory to one another. And even those who are doing their best aren't quite clear on what's okay and what's not okay. All we are asking is for you to do your very best, to use common sense, and to limit your interactions with others as much as possible to help get us through this. We know it hasn't been easy. It's been tough on every one of us. And I would also ask that you have some understanding, some patience, and really some grace. We are all going through this together. It has been extremely challenging. So let's just remember, the vaccine is here. These are difficult times, but there is a light at the end of the tunnel. And I can't wait until we're able to get back together again and able to celebrate without a mask on. That day is coming. So let's get through this together. Thank you, everyone, for all that you've done and what you've continued to do. And now I'd like to introduce Dr. Edler to talk a little bit about what UCSF's role is in helping to distribute the vaccine.
Thank you very much, Mayor Breed, and good morning to all of you. Let me just start with a couple comments about the public health orders. UCSF has been a partner in supporting the San Francisco health orders from the beginning. And we know that they've been effective in helping to slow the spread of COVID-19. We've seen this in our own data for our hospitals and our clinics. But in particular, as we've examined the situation in other health systems throughout California or the United States, it's imminently clear that the San Francisco health orders have helped to keep our case numbers and especially the numbers of hospitalized patients in San Francisco lower than most other urban areas. And the importance of this is that it has allowed our hospitals to continue to function in a somewhat normal fashion without becoming overwhelmed, as has happened elsewhere, both in our state and in the country. And that's enabled us to continue to serve all the patients who need hospital care throughout the pandemic. So we are committed to continuing to work with the city and county to support residents through this pandemic and encourage all of you to do the very best you can to ensure that you continue to comply with these health orders as they are so important. Let me turn to vaccines for a moment. So with the approval of 2 vaccines in the US, UCSF is now very focused on vaccination as supplies become available. I will say that the size and scale of this effort is unlike any we've ever seen. So let me describe in briefly how UCSF as one health system is part of the chain to provide vaccine to people of San Francisco. So UCSF is part of what's called a multi-county entity, along with our colleagues at the other UC health systems throughout California. And as such, the vaccine is allocated to UCSF directly by the California Department of Public Health. And then the deliveries come to UCSF from the vaccine manufacturers directly based on the allocation of the California Department of Public Health. It's clear that this is a major and complex initiative, and all of us are learning as we go. What's also clear is that we need to increase the rate at which we are able to deliver vaccine to people. And I believe that from the beginning of the time we started vaccinating 2.5 weeks ago, that this is already happening. For example, at UCSF, we're now able to vaccinate up to 1,100 people per day and are working to increase this number even further. At the moment, we are continuing to focus our efforts on vaccinating healthcare workers primarily, and then hope to move on to additional groups in the next few weeks. And I can say that so far, the supply of vaccine from the manufacturers and from the state has been able to keep up with the rate at which we are actually vaccinating people. And we hope that this will continue, particularly as we increase the number of people we can vaccinate per day. Thank you. I'll turn it back to you, Mayor Breed.
Thank you so much. And now I want to turn it over to Dr. Grant Colfax to provide an update on where we are in the city with our numbers. And thank you so much for joining us today, Dr. Colfax.
Good morning, and thank you, Mayor Breed, and thank you, Dr. Adler. We've always had, the health department has always had a special relationship with UCSF, and we really appreciate the support during this unprecedented time. I also want to express our support for the people and communities in Central and Southern California, where the COVID pandemic is particularly severe and the situation is dire. And my gratitude to the thousands of people on the front lines in San Francisco fighting the virus every day, including in our hospitals, skilled nursing facilities, community testing sites, and now vaccination clinics. And of course, to all of you who live and work in San Francisco, who have sacrificed so much for nearly a year. A tough year, but I have great hopes for 2021, and I'm sure you do as well. And nearly 12 months into the pandemic, and with the holidays, I know this has taken a toll on us, including on our mental health and well-being. So I want you to know that if you or someone needs help, it is available. You can call our behavioral health warm line at 855-845-7415 to talk with someone who knows what it's like to struggle with behavioral health issues. Or please reach out to your primary care provider or counselor. We need to care for ourselves and each other during this time. I hope we can all commit to that. Another hope, of course, is that we will continue to join together to save lives and fight the current surge of COVID-19, to vaccinate our residents and workers against it, and to finally overcome this pandemic that has dominated our lives. The great news is that the vaccine is here, and it is being administered every day. But it will not have much of an impact on our current surge or any post-December holiday surge we may experience in the coming weeks. We remain in a serious and critical position, but our collective actions are making a difference. Our cases of COVID-19 and unfortunately our deaths due to COVID-19 in San Francisco continue to increase, but the rate of increase seems to be slowing. However, at this time, we do not know the full impact of the December holidays, and it is plausible that we could see a sharp increase in cases followed by hospitalizations in the next few weeks. Let's see where we currently are. Could we have the slide, please? As this slide shows, our number of cases have been on an uptick. This slide shows we are currently at 27 new COVID positive cases per 100,000 people here in San Francisco. And right now we are averaging about, could we go to the slide before this, please? This is the slide. This slide shows that we're averaging about 27 cases per 100,000 people in San Francisco. And we are averaging about 237 new cases of COVID-19 every day. We have seen an increase, as you can see, since December 24th, but the 237 new cases per day is still a drop from about 290 new cases we were seeing in mid-December. But given the infectiousness of this virus, 237 is still far too many for us to let our guard down. When we stay home, avoid gatherings, stay physically distant, and wear masks over both our noses and our mouths, we will drive this number down. We will keep our fellow San Franciscans and ourselves from getting sick, help prevent hospitalizations, and make sure that we are all here for the vaccine. Next slide, please. Now, this shows the hospitalizations of people with COVID-19 since the pandemic began. As you can see, the number of people with COVID-19 who need hospital care continues to climb, as we would expect when number of cases climb. But thanks to your efforts with regard to precautions, hospitalizations appear to be climbing more slowly now. But as with cases overall, we will not know until mid-January how many people got COVID-19 over the Christmas and New Year's holiday and became seriously ill, requiring hospitalizations. That's just based on how long it takes for people to show symptoms and become severely ill from COVID-19. That usually takes up to a week or even two. Currently, and unlike many parts of the state, hospitals in San Francisco have enough room to care for COVID-19 and other patients. Locally, we have roughly 35% of ICU beds available. However, across the region, just 5.9% of beds are available. And because our regional ICU bed availability remains well below the state's threshold of 15%, we here in San Francisco will remain under the state regional stay-at-home order. And as you know, the situation is much worse in Central Valley and in Southern California. And while we have those ICU beds now in San Francisco, it is plausible with our regional or statewide surge that those numbers of ICU capacity will drop sharply, perhaps due to a worsening of our local situation or because of needs in the region and the state. Staying home, as hard as it is keeping our already strained health system from being overwhelmed. It is saving lives. Now, I want to talk a little bit about vaccines. We are working with our healthcare partners, including UCSF, throughout the city to get as much vaccine into as many arms as possible. Unlike testing, we do not have local control of when vaccine is sent to San Francisco or how much is received. The federal and state government have developed a distribution plan for the vaccine, and the state has defined the prioritization plan, which we must follow locally. That distribution plan ships vaccine directly to healthcare providers, such as Kaiser, CPMC, Sutter, UCSF, and DPH, which is a healthcare provider in the city, primarily for people who have Medicaid or who are uninsured. With the exception of the vaccine DPH, the health department, gets from the state, we currently have no ability to track the amount of vaccine that is being sent to providers. I can tell you this, that the Department of Public Health, as a healthcare provider, has vaccinated more than 6,000 people. Most frontline acute care staff at Zuckerberg San Francisco Hospital and Laguna Honda have been vaccinated, and nearly all paramedics and EMTs have been offered the vaccine. And after today, over 90% of the residents at Laguna Honda will have received the first dose of the Pfizer vaccine. That is great news. Given the limited initial supply of COVID-19 vaccines, the state has developed a phased approach in which groups of people will get the vaccine and when. The first phase, the phase we are in now, defined by the state as phase 1A, prioritizes those workers in healthcare settings most likely to be exposed to the virus and most needed to support our healthcare system. In San Francisco, that is estimated to be over 80,000 healthcare workers, including nurses, doctors, technicians, environmental service workers, nutrition service workers, EMTs, paramedics, and many, many others. The majority of these workers are being vaccinated by their employer, whether it be the health department, CPMC, UCSF, Kaiser, and so forth. We are waiting for the state to finalize the next phase, which is proposed to include frontline essential workers such as public safety, grocery workers, teachers, and those over the age of 75. And we are working with the city's healthcare providers and pharmacies to scale up vaccine delivery. Since the federal and state government are distributing vaccine directly to healthcare providers, these partnerships are vital to our collective success locally as a region and across the state. We are discussing with our health partners ways to increase vaccination capacity and accessibility. Our goal is to ensure that vaccination is safely provided to as many people as quickly as possible and as soon as we get vaccine. This is an unprecedented undertaking, the mass vaccination of the entire nation to end the pandemic. We are working hard, but right now vaccine supply remains limited and many questions remain unanswered with regard to how soon vaccine supplies will meet demand. But please know, and we expect that everyone who wants a vaccine will get one eventually. And we will work together, as we have done throughout this pandemic, to make this happen. While we plan for the availability of the vaccine, we still must make a difference in this current surge by supporting each other and continuing to make good and smart choices that we know slow the spread of the virus, such as wearing a mask over both your nose and your mouth when you go outside, avoiding gatherings outside of your immediate household, and physically distancing whenever possible. As we start this new year, nearly 12 months into this pandemic, believe me, I am counting the days. Let's remember that our collective actions have changed the course of the virus in March and July. We can and we will do it again. Thank you.
Thank you, Mayor Breed, Dr. Adler, and Dr. Colfax. Before we start the Q&A portion with Dr. Colfax, we're going to take a moment to allow reporters to submit questions on WebEx. We'll be right back. Thank you for your patience. We'll begin shortly. Thank you for your patience. We have a number of questions from various news outlets, and they are, and so right now our team is sorting them. So we'll be with you shortly. Thank you, Dr. Grant Colfax, for your patience, and thank you, reporters, for your patience as well. Dr. Colfax, are you ready?
I'm ready. Hello.
Okay. Thank you for your patience, everybody. Dr. Colfax, your first set of questions comes from various news outlets. California has 6 confirmed cases of the new coronavirus strain. Which strain is more contagious and severe, and is there any new and detailed plan to stop spreading the strain? There is a follow-up question. How can San Francisco track the possible new strain?
So when you're referring to the
UK.
Yeah, to the UK strain, we know that the UK strain now is responsible for the majority of infections in the UK. And as we know, it has been detected across many parts of this country. We have not yet detected the new strain here in San Francisco, but certainly would not be surprising if and when it does get detected. And a number of laboratories, including at UCSF, are serotyping, are typing the virus, doing genotyping of the virus of select samples to determine if and when this strain does show up. Unfortunately, there's not a lot of capacity to do that, so only a very small number of samples are sent to laboratories for this subtyping. But again, we would not be surprised if and when it is detected in San Francisco or in the region. I think a couple of things about the virus. While it does appear to be more transmissible than other variants of the virus, it does not appear to be more lethal. And there is no reason at this time to believe that it is somehow resistant to the vaccine. And I think most importantly for people going about their lives right now, it just reinforces the need for us to practice those prevention activities, to wear a mask over both your nose and your mouth, to physically distance, and again, not to gather, because with more virus out there than ever before, and with the likelihood that this variant is out there, the things that we may have done in the past and yet we avoided getting infected, those activities are much more risky now.
Thank you, Dr. Colfax. The next set of questions also come from multiple news outlets. Why does San Francisco have so much more ICU availability than the regional average? Even some counties that have had similar public health responses. And a follow-up is, could you expand on what you said about San Francisco's ICU capacity potentially dropping because of needs across the state?
Sure. So I think right now our ICU capacity is in reasonably good shape compared to certainly the rest of the state for a number of factors. Primarily, we have, as a community so far, weathered the worst of surges. So we simply don't have as many people proportionally in our hospital system with COVID-19 because of all the efforts that we have invested and the sacrifices that we have made. The other key piece right now is seasonally, during the holidays and right after the holidays, there are generally fewer people in the hospital for elective surgeries and so forth. So we have more hospital capacity for that reason as well. And we have been working very hard with our hospital partners in the city to ensure that ICU capacity is maintained as much as possible. With regard to that ICU capacity being used for people in need across the state and even indeed across the region, there is a statewide system by which hospitals, regions can ask for assistance to transfer patients when they run out of capacity, to transfer patients into another jurisdiction. Right now, for instance, we have 4 patients in our ICUs across the city who are from outside of San Francisco. And while we have care available and people need care, it's the moral and ethical right thing to do to provide that care when asked and when needed. And again, we are watching that number our capacity very carefully, because as the central and southern part of the state continue to experience really catastrophic situation, and as the region has fewer ICU beds, we would expect our local ICU bed capacity to start going down as well. Obviously, I hope that doesn't happen, but it certainly is plausible at this time.
Thank you, Dr. Colfax. The next set of questions, again, come from various outlets. And it's a 2-part question. How many vaccine doses has San Francisco received from the state? And of those, how many doses have been administered? And a follow-up, how often is San Francisco receiving vaccine doses?
So as Dr. Adler mentioned, the multi-county entities, Kaiser, UCSF, and others are receiving a vaccine as allocated by the state. We do not have visibility into those numbers as of right now. The state is working on data systems to allow us to have that visibility, but I don't have those numbers, unfortunately, available. They have not been made available to us. I know the state is working very hard to get those numbers to the local jurisdictions. What I can tell you is the health department has delivered 6,000 vaccines to people in our system, the frontline workers at Zuckerberg, Laguna Honda Hospital, and our EMTs and paramedics, among others. So we have administered 6,000 vaccines. In the first distribution of vaccines a couple of weeks ago, DPH received 30,000 vaccines that were distributed to these other entities across the city. After that, the state switched to this multi-county entities distribution system, and we do not have those numbers available at this time.
Thank you. Again, the next question is from various news outlets. have San Francisco hospitals had any excess supply of vaccines? And if so, how have they determined how to distribute them?
Well, I wish I wish that were the case, and I can say that we are pushing vaccine out into arms as quickly as possible. I know all the entities in the city are doing that. That has not been an issue. We are getting vaccines into arms. Certainly, demand for the vaccine far outweighs supply, and we are working with our county partners to scale up vaccine distribution as quickly as possible so that we will be ready when more vaccine comes. Again, right now, demand far outweighs supply. We are still in that phase 1A as required by the state, that phase 1A tier. That's over, we estimate that's over 80,000 people who live or work in San Francisco who need vaccine. And this is, remember, the first dose. We're just starting the second doses this week.
Thank you. This question from various news outlets: what are the city's plans for administering the vaccine to San Francisco's immigrant community and people who are undocumented?
So vaccines will most likely be distributed through healthcare providers. And we will be doing extensive outreach with healthcare providers through media, through trusted community partners, community stakeholders, community-based organizations to let people know that vaccine is available. As you know, in San Francisco, we have a robust healthcare system. Anyone, regardless of immigration status, receives top quality care, including at the health department. And we are working very, very hard with stakeholders in communities, including immigrant communities, to ensure that people understand about the vaccine and that people are able to will be able to access vaccine when it is available.
Thank you. The next question comes from multiple news outlets. New York City is setting up mass vaccination sites in its 5 boroughs to avoid delays in getting people vaccinated. Is that possible in San Francisco?
So there have been no delays in people getting vaccinated at this time. Again, demand for the vaccine far outweighs supply, and we are working with our healthcare providers who we expect will be receiving the majority of vaccine. These multi-county agencies, Kaiser, which as we know covers many, many people in San Francisco, Sutter, Dignity Health, UCSF, and of course here at the health department, to explore whether we can whether the vaccine will be more rapidly distributed and made available to people through these types of mass vaccination sites. And we are working with them to ensure that, again, vaccine gets into as many arms as quickly as possible. Our goal is to make sure that vaccine is not sitting in the freezer, and that as soon as the feds and the state supply vaccine to local jurisdictions, to healthcare entities in San Francisco, that we get it into as many arms as quickly as possible.
Thank you. The next set of questions come from multiple outlets. How will San Francisco determine who will be next in line for vaccines? And is San Francisco taking any COVID-19 patients from outside the county and/or region? So
I will answer that second question first. As I had said, there are 4 patients who are transferred from outside that we know of that are transferred from outside of San Francisco in our current hospital systems across the city. So that total is 4. With regard to determining who goes next for the vaccine, we are required to follow the state recommendations. Again, we are in that phase 1A. We are waiting for the state to finalize that phase 1B, which includes the essential workers and people 75 and over. And then it's been anticipated that there will be a phase 1C. So we will be following the state guidelines in terms of prioritizing those populations for vaccine.
Thank you. And Dr. Colfax, your final question of the day from also various news outlets. What is the current situation with infections at Laguna Honda prior to vaccinations?
So I think the really great news is that vaccinations started yesterday for residents at Laguna Honda. Over 300 were vaccinated. We expect vaccinations to be completed by tomorrow. Right now, we have 15 Laguna Honda residents who have been diagnosed with COVID-19, and we have 34 staff who are diagnosed.
Thank you, Dr. Colfax, for your time today. This concludes today's press conference. We want to thank Mayor Breed, Dr. Adler, and yourself, Dr. Colfax, for your time.
Thank you.
For future questions, reporters